Hello everyone, a very good morning. I am Dr. Chirag Chamria. I am an oral and maxillofacial surgeon practicing with Royal Dental Clinics since the past 4 years. So friends, let's talk about something which not everybody experiences, but if you have experienced, you know the trouble and the pain you go through. Let's talk about an erupting third molar. So friends, third molar is the last tooth to erupt in the mouth. It is the last molar, the backmost teeth to erupt. In most of the cases, when these third molar come, they do not cause any pain, any trouble. And if there is enough space in the mouth, they would erupt and they would function like your other teeth. But in many cases, as high as 1 in every 5 persons will have some or the other trouble involving the third molar. So what are the most common issues which everybody feels, or which most of the people would feel in relation to third molar? So one of the problems is that it may cause cheek bite, or it may cause the gum envelope to remain there, thereby causing inflammation of the gums in that area. It may cause severe pain if it is impacted. It may cause food lodgement and decay of the neighboring tooth, or it may never erupt, stay inside, and create certain cystic changes. Although all these pathologies or all these abnormalities are not very common in the oral cavity, but they do affect a very large population. So, should we remove all third molars, or should we wait, or what is the decision-making process involved in relation to third molars? So the best decision makers for third molars is your regular dentist. A general regular dentist who you keep visiting every 6 months to 1 year can take series of x-rays and can understand the position of the third molar and the changes which are happening in that region. In cases where the third molar is not going to erupt and it has started to cause decay to the neighboring tooth or pain due to pressure in the area, it is recommended we remove this third molar. If the cystic cavity or the cavity around the third molar into the bone is increasing in size periodically on the x-rays which we observe, then it is required that the third molar be removed. There are other many non-aggressive ways which we can also treat the third molar. For example, we can have something called as the tooth stippling or enameloplasty, which helps the third molar to erupt. We can just remove the tissues over the third molar called as operculectomy, so that to facilitate the third molar which can erupt in the mouth normally. Sometimes when the patients have lost their first molars or the premolars, the molars behind that and the third molar can be pulled back into position to function in the normal dentition. So, in India, we usually do not recommend all third molars be removed, but we always put third molars under observation. By taking a series of x-rays every 6 months to a year, we can mark out the progress of that third molar eruption. In cases where the patient is above 40-45 years of age, the third molar is deeply seated into the bone, not causing any trouble, not causing any changes on x-rays, we do not advise the patient to undergo any surgical treatment. The surgical treatment involved in removal of third molar involves actually cutting into the bone, exposing the third molar, cutting the third molar into pieces and removing it upstream. It is most common that the lower third molars are involved as compared to the upper third molars. In removal of the upper third molars, usually a normal fat graft from the buccal pad of fat is placed so that the area closes and seals well. So friends, I hope this particular short video has helped you understand what a third molar troubles could involve. They could involve pain, swelling, inflammation, which are controlled by antibiotics and surgical treatment. But the pain in third molar is not always related to the third molar. It can also be related to the cavity which the third molar causes on the second molar. I hope this video helped you in making the decision making process for your third molar removal, and you would get an opinion from your dentist of what you require.